Sage twist, Mariachasana. In this pose, spinal rotation is not an isolated local phenomenon involving only the vertebrae. Kinesiologically, the rotation creates complex reciprocal ties between several structures that are involved in the action, among them the pelvis and the hip joints. Ranges of rotation in the various regions of the spine: lumbar, thoracic, and cervical. The range of rotation in the lumbar region is only up to 5 degrees. The range of rotation in the thoracic region is 35 to 40 degrees. Between vertebrae C2 to C7, rotation is about 40 degrees. Between vertebrae C1 and C2, there is additional rotation of about 40 degrees. Total spinal rotation is about 120 degrees.
Effect of vertebral rotation on respiratory functions. The lungs do not have the independent ability to increase or decrease their volume. They are activated as a result of changes in the ratio between internal and external air pressures that stem from reduction or expansion of the chest. Lowering the diaphragm towards the abdominal cavity and raising the ribs enlarge the chest cavity. This is accompanied by the inspiration of air. Reversal of the movements decreases chest cavity volume and is accompanied by expiration. It is important to maintain the elasticity of the chest in order to facilitate normal respiratory function. Twist positions have a positive effect on elasticity of the chest. These spinal rotations improve the movement of the joints that are connected to the chest. The joints between the ribs and the vertebrae, T1 and T12. The sternocostal joint.
Common problem: difficulty in performing full rotation in the spine because of bending in the back. The reasons for flexed back can be shortened hamstrings. Shortening of the hamstrings with straight leg causes strong pelvic backward rotation and flexion in the back. In addition, posterior pelvic tilt is a chain reaction to full flexion of the thigh. The greater the flexion of the hip joint, the more the pelvis tends to rotate backward. When the pelvis is rotated, it is not possible to maintain lumbar lordosis. In a condition of bent back, the range of spinal rotation is reduced. Solution: elevate the pelvis by placing a rolled-up blanket, cube, or pillow under it. In many cases, it is recommended to perform the position with elevation to allow full straightening of the spine. Elevating the pelvis reduces the range of hip flexion and also reduces the stretch load on the hamstrings. Elevation allows anterior pelvic tilt and in a chain reaction maintains lumbar lordosis. Common problem: Common problem. Functional stiffness of the shoulder girdle is a factor that limits the range of rotation in the back. The intention is to create spinal rotation when it is straight and elongated upward. In a flexed position, it is not possible to perform a full range of rotation. One of the various reasons for flexed spine is a shortening of the pectoralis minor. Shortening in this muscle pulls the scapula forward and in a chain reaction does not allow full straightening. Another common reason is functional stiffness in the joints between the thoracic vertebrae and the ribs, characteristic of conditions of kyphosis. Solution 1. Adjust the location of the supporting hand behind the back. In order to facilitate better opening of the thorax, it is important to rotate the arm laterally, outward. Lateral rotation of the arm causes adduction of the scapula in a chain reaction. Solution 2. Make the chest more prominent by lowering and adducting the scapulae. Make the chest more prominent and lengthen it upward by bringing the scapulae close to the spine and lowering them, moving shoulders away from the ears. Solution 3. Preparatory exercise for softening the spine. As preparation for rotations center on the spine, it is recommended to use a more integrative movement that includes many joints, open cycle, and later to perform focused rotations in a closed movement cycle, such as sitting positions.
Thoracic rotation, from isolation to integration. The aim of this exercise is to improve articular mobility in the horizontal plane. Instructions: 1. Pelvic rotation. 2. Pelvic rotation plus spinal rotation. 3. Rotation with flexion. 4. From flexion to extension. Main points. Implement the isolation to integration principle in the drill to emphasize thoracic movement.